Welcome back to American Christian or Christian American. This is kind of a part two of my healthcare video I just did. And part of the reason is I had the information, I didn't get this in here, but the video was long enough as it was. So I made a second video. I'm just going to go over some facts. I'm even going to come back to my face and I'm just going to conclude with the document. And this goes along with what I was talking about in the video, just the previous video here. So look at this information, this will be helpful to you, and consider it. And just remember that healthcare in this country has been denied to people because of the hatred for black people in this country. But then it merged into the idea of greed and selfishness. And really, your family deserves better than that. Your friends deserve better than that. Other people deserve better than that. And so take a look at this video, and then we'll talk again on the next time American Christian or Christian American. I was talking about here, we're just going to go through this. I didn't get this in the last episode, so this is just a supplement to the other episode. If you haven't watched the other episode where I talk about how the reason we don't have a single payer program or Medicare for all in this country has huge connections. In fact, they're almost the 100% the original reason why we don't have it is because of a racist country who wanted black people to die off. Now, greed and all those other things have come to the system as well to be another hindrance. But so we're just going to talk about this page just a little bit. Again, this is to add on to what I did in the other episode. Physicians for National Healthcare, PNHP. So you can look this up for yourself. If you can't remember anything else, remember PNHP or Physicians for National Healthcare. And you should come up with this page. So it's going to talk about some simple facts here, and you can do more research. You can also look up in different things on here that I'm not going to discuss. But it says facts about national health insurance you might not know, which is what single payer is. The healthcare delivery system remains private. So that's what would happen. The private clinics and other hospitals and stuff would remain private, as opposed to a national health service where the government employs doctors in a national health insurance program. The government is billed, but the doctors remain private. So like in Britain, they have a national health service, which there it is a nationalized system where the doctors are employed by the government. However, they rank much better than we do in healthcare. But that's not what is being proposed for this country. It's being proposed like Canada and other places where the funding simply comes like an insurance company, but done in a much more cost-effective way and a way where there's not huge profits involved. The funding is done. The doctors would submit a bill to the single-payer system. The single-payer system would pay out what is supposed to be paid out for the particular item. All right. National health insurance programs save approximately $150 billion on paperwork alone. So because of the administrative complexities of our current system, over 25% of healthcare dollars goes to marketing, billing, and utilization review and other forms of waste. A single-payer system could reduce administrative costs greatly. So, for instance, a hospital or clinic doesn't have to worry about what insurance to bill it to. They don't have to worry about arguing and trying to resubmit it. So the job becomes much easier. It's just submitted to the National Health single-payer system, and it's paid out to the doctor in whatever time measure it's supposed to be. So there's no real argument about it. And clinics are also going to know what is paid for and what is not. It's very, very clear cut because it isn't, you don't have insurance companies trying to argue about the fact whether or not, because they don't want to pay it. They want to try to get away with not paying it. All right. Most businesses would save money because of a single payer system is more efficient than our current system. Healthcare costs are less, and therefore businesses save money. In Canada, the three major automakers, Ford, GM, and Daimler Chrysler, have all publicly endorsed Canada's single-payer healthcare system from a business and financial standpoint. Now, this is a little bit old because Stellantis was in there, but it's the same fact, so it hasn't been changed in this area because it really applies to the same thing. In the United States, Ford pays more for its workers' health insurance than it does for the steel it makes for its cars. So, and this is all to make people, insurance companies and drug companies, extremely wealthy, while the American people suffer and many times die because they don't get proper care. Under a national health insurance, we're talking single payer, and what's been proposed in this country is the title, the name, Medicare for All. That's only a title, just like Medicare is a title. And that title came from Canada. We copied Canada. Their system covers everybody. Our system covers seniors over 65 at 80% and not 100%. And the reason for that is, we had talked about in the last video, which you should watch if you haven't watched it, is because of racism. They didn't want black people to have access to 100% Medicare. They're hoping that they couldn't afford health care, and it would cause, as they would put it, the death of the race. But as we know it, there is only one race, the human race, and white people weren't first. But that's what they say. All right, myths about national health insurance. The government would dictate how physicians practice medicine. In countries with national health insurance, meaning a single-payer system, physicians are rarely questioned about their medical practices, and usually only in cases of expected fraud. Compared to today's system, where doctors routinely have to ask insurance companies permission to perform procedures, prescribe certain medications, or run certain tests to help their patients. So none of that would really exist unless they feel like the doctor is doing something that would be illegal and trying to take advantage of the system. Otherwise, if the doctor says you need it, you get it. Now, again, it still would be good on the patient's idea sometimes to get a second opinion, but they don't have to worry about the insurance companies doing that. It's just about another doctor. In fact, the insurance company, they don't have to worry about the other doctor being influenced by the insurance company. It's just the other doctor's opinion according to what medical prognosis has been for your health. Waits for service would be extremely long. Again, in countries with a national health insurance, urgent care is always provided immediately. Other countries do experience some waits for elective procedures like cataract removal, but maintaining the U.S. same level of health expenditures, twice as much as the next highest country, waits would be much shorter or even non-existent. People would overutilize the system. Most estimates do indicate there would be some increase in utilization of the system, mostly from the 42 million people that are currently uninsured and therefore do not receive adequate health care. However, the staggering savings from a single-payer system would easily compensate for this. And remember, doctors still control most of... Okay, I had to cut off the video for just a second, so I'm just making a second one and reattaching this together. I want to back up just a little bit. It says, and remember, doctors still have control of most healthcare utilization. Sorry about that. Patients don't receive prescriptions or tests because they want them. They receive them because their doctors have deemed them appropriate. A lot of times we have advertising in this country which for prescription drugs and these things. And if it's still true, the only places that allow it is Australia and this country. No other country allows for prescription drugs to be advertised on TV, because how can you really know what you need? The doctor should be familiar with these drugs, and they prescribe what they think is the best for you. They're the experts in doing this. A lot of times patients go begging their doctors for these prescription drugs. I don't know how often the doctor gets into that, but our system is based on expertise. Now, why? Just a little thing. Why there might be some fraud with doctors and other things. Most of the problem with our healthcare system is the insurance companies and the prescription drugs. However, even other fraud would be corrected to a point here, because the system is going to pay what it pays for a particular procedure. Now, there will probably be cost of living differences for different areas of the country. For instance, California, New York City, those areas where it costs more to live, then they might pay out more to those doctors and nurses in those areas or the clinics because the costs are higher. But also, more money would be brought in by the higher wages that are there. So the more people make, the more they pay into the national healthcare system. All right, government programs are wasteful and inefficient. Some are better than others, just as some businesses are better than others. Just to name a few of the most successful and helpful, the National Institutes of Health and the Centers for Disease Control and Social Security even consider Medicare, the government program for the elderly, its overhead is approximately 3%, while private insurance companies' overhead and profits add up to 15 to 25%. And I think it's more like 20 or something like that percent. So you would save a great deal of money there, and you also save money on the amount of people you hire for doing billing, because you wouldn't have to have as many people doing that because the system is much more simple. Just in those things alone could save money to pay doctors and nurses to do the system. Uh, Negotiating drug prices down would also be a huge boost to the system. So, on top of what I've already discussed in the other video, I broke it down from my experience. This is just one resource out there. Now, you're going to find resources that talk against it. But understand a lot of these resources have ulterior motives in mind: racism and huge, huge profits for industry. They're going to lie about all this stuff. But this is the only major country, that industrialized, wealthy country, that doesn't have a national healthcare system. Why are we the only ones when all these other countries have some form of national healthcare system? Some involve some types of insurance, true, but they're still regulated, and it's not just insurance. But many countries either have a single payer system, or like Britain has the National Health Service, which it does hire the doctors and nurses. And why that's not what we're going for, it also has been very successful. So what we have now is killing people off. And as we talked about the fact that this is based on racism, understand that the leaders of this country, the insurance companies, and those people who hate black people and other people in this country are willing to allow millions of white people also to die off just so they can hurt black people. Now, if you have a problem with black people, think about it. Are you willing to hurt yourself in the process? It doesn't make any sense. Now, I don't understand why anybody hates people, but I'm just making a point. This system will sacrifice anybody to achieve their goals. We need something like Social Security, which needs to be expanded, by the way, um, something that people can depend on. And if the laws are in place, you can trust that better than you can a corporation. Now, yes, there's problems with government, but remember, the government officials have to be elected. You do have a choice there and control. You have less control over corporations. So if the law is updated right now, Obamacare or the Affordable Care Act, they're both the same thing. Some people say they don't like Obamacare, but they want the Affordable Care Act. No, they're the same program. It has helped some, but it still involves these insurance companies. It still makes these insurance companies incredibly rich. Why pay them all that money when you could have that money to do other things? All right. Till the next time, an American Christian or Christian American, I'll conclude here.